Okay, let's picture this. You've got an infection, your doctor gives you a prescription. Simple enough. And hey, maybe you're also taking something for muscle spasms. Super common. You'd think you're totally safe, right? Well, what if I told you that mixing two incredibly common, helpful meds could actually be a recipe for disaster? Today, we're going to uncover a really serious risk that, honestly, everyone should know about.
All right, so let's meet our two main characters. On one side, you've got ciprofloxacin. This is a heavy-hitter antibiotic, a real go-to for doctors when they need to knock out a nasty bacterial infection. And on the other side, tizanidine. This is a super common muscle relaxer, brings a ton of relief to folks dealing with spasms and tightness. You know, on their own, they're both heroes, helping millions of people feel better.
So yeah, individually, they work great. But when they end up in your body at the same time, that's when a major problem pops up. So what's the deal? Why does this seemingly friendly team-up turn into such a dangerous combination? That's the big question, and we are going to dig in and find the answer. And look, this isn't just some little be careful note buried in the fine print. No. The official drug interaction reports on this combo issue one of the most serious warnings you can find in medicine.
And that warning comes down to one powerful word: contraindicated. When you see this word in medicine, it's a huge red flag. It's not a suggestion, it's a full-on stop sign. So what does contraindicated actually mean? Well, it's a formal medical warning. It means the risk of using these two things together is so high that it completely wipes out any potential benefit. The simplest way to put it? Just don't do it. The official report couldn't be clearer. And I'm going to quote it directly for you. Given the magnitude of the interaction, use of tizanidine with ciprofloxacin is considered contraindicated. Did you catch that word? Magnitude. That's the key here. And to really get what they mean by that, we have to look under the hood and see what's actually happening inside your body. All right, so to figure out the why behind this massive warning, we need to meet a key player inside your body. Let's call it the body's gatekeeper, because its whole job is to keep things running smoothly and safely. This gatekeeper has a fancy scientific name, of course. It's a liver enzyme called CYP451A2. Now, its main job in our story is to process or break down that muscle relaxer, tizanidine. Think of it this way. This enzyme makes sure the drug's levels in your system stay in that just right zone. Safe, but still effective. So here's how it all goes down, step by step. First, you take tizanidine. The muscle relaxer gets into your system, ready to do its job. Okay, simple enough. Step 2, our gatekeeper enzyme, good old CYP451A2, starts doing its job, processing the tizanidine just like it's supposed to. But then, step 3, ciprofloxacin, the antibiotic, shows up, and it's a blocker. It literally shuts down the gatekeeper, inhibiting the enzyme. And the result of that? Step 4, a really dangerous backup. With the gate closed, tizanidine has nowhere to go. It can't be processed, so its concentration in your body just starts to climb and climb and climb.
And we're not talking about a little traffic jam here. This backup is a massive, system-wide overload. The consequences of this gate being blocked are, to be honest, pretty shocking.
Get this. A clinical study looked at this exact interaction, and what they found was just staggering. When someone took tizanidine with ciprofloxacin, the total amount of tizanidine in their body didn't just double or even triple. On average, it increased by 10-fold.
Just look at this chart. It says it all. See that bar on the left? That's the normal, expected level of the muscle relaxer in your body when you take it alone. Now, look at the bar on the right. That towering monster is what happens when you add the antibiotic. That's not just a small bump. That is a visual of a 10 times overdose. Your body is suddenly forced to deal with 10 times the amount of drug it was ever supposed to handle.
Yeah, let that number sink in for a second. 10 times. It's like taking 10 pills instead of the one you were prescribed. The antibiotic basically turns the muscle relaxer into a supercharged and seriously dangerous version of itself.
And a 10-fold increase isn't just a number on a chart. It has severe real-world consequences. This kind of overload can cause a big and potentially dangerous drop in your blood pressure. It can mess with your heart rate. It can seriously impair your physical and mental abilities and trigger extreme drowsiness or sedation. These aren't just minor side effects. These are major system-wide problems.
Okay, so knowing all this, how do you protect yourself? It really comes down to being an active, informed partner in your own healthcare. It's about taking charge. So, here's your safety checklist. First things first, just avoid this specific combo. The science is crystal clear. If you take Tizidine, you need to ask your doctor if there are safer antibiotics for you. Next, and this is so important, always tell your doctor and your pharmacist about everything you take. That includes prescriptions, over-the-counter stuff, vitamins, everything. Keep an updated list on your phone or in your wallet. And finally, never ever hesitate to ask that simple question. Hey, does this new prescription interact with anything I'm already taking? It's your health on the line, and you are your own best advocate.
The story of ciprofloxacin and tizanidine is a really powerful reminder that even the most common medications can have incredibly complex and sometimes hidden effects. It really makes you think, doesn't it? What other dangerous interactions could be hiding in plain sight, right in our own medicine cabinets? Stay curious, ask questions, and most importantly, stay safe.